Before we start off this session, we have a talk by Dr. Elankumaran Pasupathi he is a medical director of Navashakti Netralaya, Bangalore. Sir, please come. He is the president of Bangalore Ophthalmic Society and treasurer of Karnataka Ophthalmic Society and joint treasurer of AIOS. He'll be giving a trade talk by Appaswamy titled Dry Eye. Over to you, sir.
Thank you, Dr. Nilufar, and thank you for accommodating. Sorry for the delay. My flight got cancelled and I had to probably travel to both sides of India and then come here from Bangalore, Chennai, and then here. That's how this talk was delayed. That's the talk for the day. This is actually, I think Appaswamy has asked me to present this, and they've asked your people also. All of us know that tear film has 3 layers. And the most common type of dry eye is evaporative dry eye. All of us know this, so let's not get into this. All of us also know that the treatment for dry eyes, of course, started with artificial tears, but then you can see this inside ring. All these have to be treated. Broadly, that can be classified into 3 different types. One, meibomian gland disease, other, infections, and third, lid disorders. Along with this, inflammation has to be treated and lubricants has to be given. But then, what if we can provide all these 3 in one? That's where comes the role of IPL or IRPL. We are going to talk about IRPL. I'll tell you what is the difference between IPL and IRPL later. But then for the time being, IPL, it was an incidental discovery, very accidental discovery, wherein this IPL was used by dermatologists, and Rolando Toyos found that when IPL was used on the face, even the dry eye symptoms decreased. That's how we accidentally found out that this is being used. Now, what is IPL? Starts from around, it's a light therapy, that's all. Starts from around 380 nanometers till around 1200 nanometers of light was used on the skin. This was meant predominantly for the skin. That is what it was used. How IRPL is different, we'll come to it later. But what we can see here, the lesser the wavelength, it can penetrate only probably 1 millimeter into the thing. Dermis, probably a little bit of subdermis. But then larger wavelength is the one that goes below and does the action. What are the actions? Again, we'll have a look at it later. That's where we started. It was in cases of rosacea and other skin lesions. Dry eye was being treated, and he found out that this works also for dry eye. That is the machine. Only thing what I want to talk about, this is an IRPL machine. Any machine that delivers IPL is intense pulse light, IRPL is intense regulated pulse light. Anything that gives this light has a power supply, a capacitor, and a cooling system. The advantage, one of the advantages of this IRPL, it's a patented cooling system, cools faster, safer for the patient, and then there is a handpiece, just like how our phaco handpiece is, there is a handpiece which delivers the light pulses. What are the mechanisms of action? Lot of mechanisms have been spoken about. All these are the mechanism of action. We'll get into it in detail. Most important, and the first thing that was found to have the telangiectatic blood vessels, that is abnormal blood vessels on the skin. It causes shrinkage by causing coagulation. That's the first thing. How does this help? If blood supply is reduced, inflammation is reduced. Hence, all these inflammatory mediators in the tears have been noted to be reduced. Second, this is the most important what is being studied now. There's one more important than this. This is one of the most important is photomodulation. What does photomodulation do? Any light, particularly in the red wavelength. Remember this red wavelength, that is a larger wavelength. Why I am specifying this, we'll come to it again later. Photomodulation, with the help of particularly red and near infrared light, stimulates, excites the cytochrome C oxidase. This helps in a chain reaction which increases the intracellular free calcium concentration. So, it stimulates the physiological process in the cell. Something like this, all these alternative naturotherapy without using things, that's something like that, but this is proven in science. Now, what does this photomodulation do? Number one, increases the collagen synthesis. This is proven. So, remodeling happens. That's why they were using this on the skin, on the dermis. Number two, reduces the epithelial cell turnover. How does this help? Remember, all these lacrimal glands, all the meibomian glands are holocrine glands. What do we mean by holocrine? Entire cell is secreted as a secretion, as a mebum. So, if it reduces the epithelial turnover, there is less reduction of this excretion of the cells. So, how does this help? Clogging is reduced. Again, this is an action of photobiomodulation. Also, the light radiation decreases the reactive oxygen species levels. Now, we know that this reactive oxidation species increases inflammation. So, on the inflammation, there are two types of benefit this IRPL or IPL gives. Number one, it upregulates the good interleukins, interleukin 10, TGF beta, what you see here, upregulates, they reduce the inflammation. And also, it down regulates the inflammatory mediators IL-6 particularly and TNF alpha. Now, this indirectly causes decreased matrix metalloproteinases, which is again reduces the inflammation. So, it plays on the inflammation. This is a very proven thing. Demodex, bacterial infections reduce because this intense pulse light is absorbed by the outer shell of the bacteria and Demodex and they die. One thing which is questioned, of course, when it came out first, what was told was the temperature increase, thereby oil is liquefied and it is thrown out, but then that is questioned nowadays. All these is proven reduces inflammation. All these actions reduces inflammation. So, single thing to tackle all this, the vicious cycle is cut down by the use of IRPL or IPL. But what is more important is happening with IRPL, and why it's happening is what I'm going to show now. All of us know that there is another cycle here. The sensory nerves carry the sensory information and thereby makes you blink. Now that is also affected by light, not only IRPL, by any light. So sensory part is over. What happens to the autonomic nervous system? We know there is parasympathetic activity, unsympathetic activity. Parasympathetic, it normally rest, coolness. Sympathetic, usually fight or flight attitude. They have to be balanced. And which of these two is important for the eye? Well, look at this. These are the receptors in the eye. 6 receptors, of which 4 are directly related to parasympathetic pathway. So parasympathetic pathway is probably more important. This is a study that was done last 2 minutes. I'll finish it off. Sorry. This study again proved parasympathetic pathway is more important, and clinically all of us know pilocarpine has been used for Sjogren's disease. So I'm not getting into this. This is the afferent pathway, how this nerve goes, but what I would like to concentrate is this particular thing. Transnasal stimulation of the nasal mucosa, increase the tear production. This has been proven, and these are the 3 methods, and this is the meta-analysis that is found in the article. You can find out that TNS helps, and the same logic is being used in IRPL in stimulating these branches of the lacrimal nerves, which carry both the sensory as well as the efferent pathway. How does this happen? Because of this light, there is microgradient change in the temperature that stimulates the nerves, releases the neurotransmitters which help. And how does IRPL help? Because there is a differential pulses that is there when compared to an IPL. These two are the short wave pulses, 2 short wave broad pulses, 6 large wave. Those are the things that penetrate and cause this parasympathetic increase. How do we use it? This is the Fitzpatrick scale. Indians normally come 2 to 4 or 5, in South Indians 5 probably. This has been specified till from 1 to 4. And 5 studies have happened. I have used in some types of 6 also. There has been no problem. That is the advantage with using an IRPL. IPL you cannot use. IRPL has been graded for the tissues. This is how you use it. 5 shots per eye in this direction. In that area, I have shown why it is. Session 1 on 0 day, 15 days, 45 days, 75 days. And with this treatment, the patient is free from problems for at least 6 months to 3 years, depending on what type it is. Again, they have a very good setup. I'm not getting into it due to lack of time, because that's not the topic. Scientists, we need to prove it, right? That's another meta-analysis which said only around 7% had problems. The rest of them were all normal. Where do we use it? Stage 2 and beyond. Thank you for the opportunity. Sorry for the little bit delay, and thank you, Dr. Nilufar, again for accommodating.
Thank you, sir, so much for your talk.
Oh, sorry, I thought it's my laptop and I disconnected it. Please.
Okay, so coming back to our